Let's talk about motor learning, which is essential when teaching individuals to develop and improve their motor control. Motor learning requires considerable sensory stimulation, adopting a multisensory approach that utilizes a person's auditory, visual, and tactile capabilities. This comprehensive sensory integration is critical to eliciting the desired responses from our patients. It's important to tailor these sensory inputs to each patient's specific needs, ensuring they are appropriate for their developmental level. This personalization helps patients coordinate better with therapists during their rehabilitation. The process involves significant interaction between the therapist and the patient. It's not just about giving instructions, it's about creating a dynamic where instructions are followed by active participation. If a patient struggles with verbal commands, therapists may need to engage in manual handling of limbs to assist movement. Therapeutic handling involves feeling the body's movements and providing targeted stimulation or support, which facilitates movement. As therapists, we use various techniques that require careful analysis and adjustment based on each patient's response. However, simply dispensing exercises isn't always effective, especially for those with motor or neurological impairments. For these patients, generic exercises may be inadequate. Motor learning must be specific and adjusted according to the unique needs of different conditions, such as aphasia, hand injuries, orthopedic issues, spinal cord injuries, or head injuries. Different strategies are employed depending on whether the patient is a child or an adult, using sensory systems that best suit their capacity for change. For example, auditory inputs might involve clear, straightforward verbal commands that are precisely timed with physical actions to enhance motor response. The tone of voice can also play a role, where moderate tones might activate gamma motor neurons and louder tones could stimulate alpha motor neurons. Visual inputs are crucial too. They help with the initiation and coordination of movement. Therapists must position themselves strategically to serve as visual cues for patients, ensuring that therapy sessions are visually oriented to support movement towards therapeutic goals. The tactile system is particularly significant in early development stages and is often more efficient than the visual or auditory systems because it provides direct feedback through touch, which is fundamental in shaping cognitive and emotional experiences. This is reflected in the way tactile input can facilitate immediate changes in motor control and behavior. In therapy, every touch, every command, and every visual cue plays a part in the comprehensive approach to motor learning. This process is about more than just physical movement. It's about enhancing the patient's ability to interact with and understand their environment through practiced, repetitive actions that are specific to their needs. Thank you for your attention, and until next time, take care.